My name is Craig Quaglia. I am a myofascial trigger point therapist and a licensed massage therapist. I have nearly 25 years of experience working therapeutic massage and in the medical specialty of myofascial therapy. Myofascial therapy is a medical specialty that is based on the interrelationships between muscles, fascia, which are the thin tissues that cover muscles and other organs, other soft tissues, and various pain syndromes. It is based on the general notion that problems in a given muscle or portion of fascia may cause pain in areas that are referred distantly from the site of the underlying cause, as well as locally inflamed areas. This discipline was pioneered by the late Dr. Janet Travell, the physician for John F. Kennedy, as well as Dr. David Simons, and is based on decades of research by physicians from around the world.
I run 2 clinics in Chicago on Michigan Avenue on the north side of Chicago. I'm a nationally board certified myofascial trigger point therapist, and I had attended the Bonnie Prudence School for Physical Fitness and Myotherapy in Massachusetts, and I attended at that time also the Albany Medical School. I've been loving treating patients and working with them all this time. We've been treating every kind of patient, but in downtown Chicago we've been treating the Chicago Bears, we're working with the Lyric Opera, the orchestra. No one should be unable to use their hands, so I'm always excited about helping people to be able to use their hands, like a dentist or a surgeon who can't use their hands anymore. I love to get them back to working again.
I am currently on the staff at the Brannick Clinic of Natural Medicine, where I had the privilege for the last 4 months of testing a remarkable medical device known as the WellWave. This product is part of a family of devices developed in Germany by Richard Wolf Medical Instruments. The WellWave relieves pain by stimulating muscles, fascia, tendons, and other tissues with focused pulses of ultrasonic energy. This technology is called extracorporeal shockwave therapy, or ESWT for short. Extracorporeal means outside the body, and ESWT is a general term for externally administered shockwave therapy. The heart of myofascial therapy is the treatment of trigger points. A trigger point is a localized area of muscle that is inflamed and is characterized by taut bands of muscle fibers that are contracted even when the muscle is relaxed. Trigger point therapists focus on locating and releasing these trigger points within the muscle and the fascia that can cause both local and referred pain. This pain, which can be intense, has been compared to conditions such as kidney stones, angina pectoris, shingles, and rheumatoid arthritis.
I first encountered the WellWave in July of 2010. And since then, I've treated well over 100 people, and I've had excellent results with it.
I am Dr. Michelle Brannick. I am licensed in the state of Illinois as a chiropractic physician, and I'm licensed in the state of Vermont as a naturopathic physician. My background is such that before I went into medicine, I was a massage therapist for 15 years doing deep tissue therapeutic work, and then I eventually went on to naturopathic medical school for 5 years and then went into chiropractic school. Then I went on to develop the Brannick Clinic of Natural Medicine, where we see enormous amount of physical medicine from acute injuries to chronic injuries. What brought me to the WellWave machine was my own personal experience. I have a history of sprained ankles, and I had sprained my ankle one night, and usually when I sprain my ankle, I'm out for several weeks, and they usually are very painful and very bad. And that night was no different. I could not put 1 ounce of pressure on the foot without having excruciating pain. Craig had come into the clinic to work on me. We worked about 1.5 hours, and we used the WellWave machine. And by the end of that therapy session, I was able to at least put some pressure on it and limp out of the clinic and go home. So that night I went home, went to bed, woke up the next morning, and I was totally amazed I actually could walk. I had never ever experienced anything like that before, where I could walk from an ankle sprain within 12 hours. My history is that it would take me 2 weeks to recover at the minimum. It was really, really amazing. In the clinic, we've experienced so many patients just having accelerated healing and movement in recovery from injuries and really long-term injuries. It's been a big asset to our clinic in that we're getting people better, faster, and even people are amazed because they've had therapies before where they have never really gotten the results that we've gotten with the WellWave machine. As a result of the demand, we purchased 2 machines, and we're very excited to have them.
The pain problems I've been treating with the WellWave are vast. So I've been treating low back pain, of course. I've been treating elbow pain, medial epicondylitis, lateral epicondylitis, that mid-back pain that people have a lot of trouble with. Also, I've been treating migraine headaches, tension headaches, knee pain, and ankle pain. And another thing we've had good results with was plantar fasciitis.
The heel bone spur that often accompanies plantar fasciitis or epicondylitis, also known as tennis or golf elbow, is an extreme form of calcified muscle or tendon attachment known generally as enthosopathy. The WellWave is unique in its ability to help the body heal these advanced soft tissue disorders in a way that drugs, surgery, and other modalities cannot. It is approved specifically to work with trigger points and myofascial pain and has just been introduced into the United States.
About 5 years ago, I had a really severe case of Achilles tendonitis. I could barely walk. So I called the Brannick clinic, and after one treatment I felt a tightness from the Achilles, and the pain seemed to be dissipating. It was going away. I had only been able to walk for like 10 minutes, and now, ever since using the WellWave, over a weekend I had walked 14 miles.
The WellWave locates and releases trigger points in the belly of the muscles, fascia, tendons, ligaments, and other soft tissues. Resolution of these soft tissue problems can even allow the body to reabsorb the extra calcium deposit that result in bone spurs.
WellWave works for trigger point therapy because it actually treats the taut bands. Now this is really going to help myofascial trigger point therapists and all physicians working with taut bands and trying to eliminate trigger points in their patients. Physicians and therapists are already using either their hands, or they're using acupuncture needles to treat the taut bands, or they're using injection needles and then stretch and range of motion. The advantage that the WellWave gives to the practitioner is that they will have an excellent additional tool to treat trigger points.
In the hands of an experienced practitioner, the WellWave makes the locating and diagnosing trigger points and myofascial pain syndromes much easier. It shortens the number of treatments while rapidly reducing the intensity of pain. It also allows the therapist to move beyond normal limitations due to muscle or tissue density and depth that often makes it difficult, if not impossible, to totally resolve a pain syndrome. This takes working with deep tissue to a whole new level.
What I like about the WellWave is that I'm able to treat a large area, and you know what else? It also treats really deep and really superficial. So I really like that for when I'm going to treat TMJ. If I'm going to treat some little tiny muscles, I can treat really superficial. But if I'm going to treat the gluteus maximus, or I'm going to treat some of the thigh muscles, then I'm going to want to go really deep. And so I'm able to do both with the WellWave.
As research continues, I believe the WellWave will continue to contribute and add to the body of knowledge that Drs. Travell and Simon's work has firmly established. I believe the WellWave is perfectly aligned with this landmark body of work.
The WellWave will allow consistent trigger point release for all kinds of healthcare practitioners, regardless of their hands-on skills.
The WellWave is safe when used properly, and in my experience is truly a game changer in the treatment of musculoskeletal pain of all types.
I see myofascial trigger point therapy becoming mainstream because the WellWave is allowing practitioners to efficiently treat myofascial trigger points and efficiently treat myofascial pain and dysfunction. And I feel that this will push the field forward.